Hi everyone, my name is Melanie Grant and this is C&M Glass. This is a video intended for review of evaluation and management coding, talking about some of the new codes in 2020, as well as a look and review of the chronic care and other care management services that we've seen pop up over the last couple of years. I want to go over a couple of key points with the new codes in E&M section for CPT coding in 2020 and a brief review on care management services, because some of these will be affected by each other and there's a lot of new verbiage in our guidelines about what not to report. This is not intended as a 2020 update video. This is primarily for the purpose of learning and training to go along with some of my previous E&M trainings where these were not talked about as they were not typically used or they were not yet in session in our previous videos. So let's get started. The first thing I wanted to talk about is just the wonders and advancement of technology, and as such, our response in E&M coding and some of the services that our providers can provide today. With this, we've seen in the past telephone services where patients can call in and get an over-the-phone visit, if you will, where they talk to the provider or nurse or somebody who then goes to the provider and a medical decision is made, like a refill on a medication or maybe a new prescription is sent in for the patient. We've also had these in the past where a patient could email a provider, but most of the time these types of non-face-to-face services were not covered. Well, we've noticed in the 2020 book, and again, I'm talking to coding only, not necessarily what the insurance may cover. In our 2020 coding book, we do have some updates on some of the guidelines with our telephone services, and these continue to stay strong and be based off of time-based amount of time spent with the patient in reviewing of evaluation and management services, specifically to the patient initiating a need for care and the provider indicating some sort of medical decision-making about the patient without necessarily seeing them. One of the biggest things about this is they're not seen within 7 days. And this is both on telephone services as well as with our new online digital services that you will find in our CPT book, starting with codes 99421 through 99423 and 99446 through 99452, as well as some resequence codes. Oh, those ones are resequenced. Some of these are, don't mind me. And 99453 through 99473. So we have a couple of them here. We also have some new revised and resequenced codes for psychological monitoring on 99457 and 458. So I'm just going over these briefly. This isn't in full detail. Of course, you should consolidate your CPT book for the 2020 year to see all of the guidelines and details in there. The first thing I did want to talk to you about, though, is what these services generally entail, what some of the guidelines are saying about it, and how does this get documented and what are we looking for. So our first one is our online digital E&M codes, and this starts at 99421. And continues through 423. Now these codes are online digital evaluation and management services. They do have some in-section guidelines, and once you read through those, you'll see this is for an online digital evaluation and management service for an established patient for up to 7 days, cumulative time during the 7 days, 5 to 10 minutes, 11 to 20, or 21 and more, okay? So this is 5 to 10, 11 to 20, and 21 plus. Okay, so what do the guidelines say about this? Well, first of all, just like with telephone services, this is an online communication where the patient is requesting an evaluation for their conditions or symptoms, which may or may not be new to the provider that they are initiating a request for. Now, they do have to be an established patient with the provider or provider office, and the way that it has to be documented or requested is through an EHR access. I think of things like here in Albuquerque, I have access to a thing called MyChart with Presbyterian and with Loveless, because I've seen providers in both. And I know with Presbyterian, they have online services that are actually free to me as a patient in terms of copay. None of this matters to me as a coder, but the cool thing about it that I've experienced is when I've gotten a cold or some other minor condition that you need to have a doctor's note for work, or you might need some medication to help you sleep at night or get through some of the symptoms, I can submit the request, including all of my symptoms, what I'm feeling, how it goes through a list of series of questions that I might answer if the provider were with me, and that then gets submitted to the provider. And then they respond to me with a review of what they think I have, whether or not they feel I need to be seen, and if I'm not needed to be seen, what their prescriptions and other advice might be. This falls under the online digital evaluation and management services, and it can only be billed for time that's spent within a 7-day period when the patient is not seen within that 7 days. Okay, so they cannot be seen within 7 days prior or after the time that we are documenting. Documentation does have to be clear on the amount of time the provider is spending based off of the evaluation of the patient, the review of any previous charts, what they're looking at, as well as their medical decision making. So they're going to need to document their time, and depending on where they fall, the first 5 to 10 minutes would be billed with 99421, and then so on as it's indicated. As you would guess, this would not be for, you would not want to bill this together, because the first one is not the first 5 to 10 minutes, it specifically says 5 to 10. So it would be one of these 3 codes when you're looking at which to use. Now there's a bunch of rules and guidelines that state do not use these with other care services. And so for that reason, we're gonna look at some of those other care services in just a minute. But basically, a lot of the coding updates and the in-section guidelines are also on those services, saying not to use those services in conjunction with these. The biggest thing to keep in mind is pay attention to what your patient has been seen for. If there's other services available, the biggest thing with these types of time-based services is that this time spent on this service is this service alone. Now, our second one is for our remote physiological monitoring services. This is another new service that's been listed in our CPT book this year. And these E&M services are things like a device the provider might have access to from their office. My first thought is like a blood pressure device, but I know there's a lot of different kinds out there, and so whether or not yours is supported, you would want to make sure to review that with the insurance or whatever guidelines. There are a couple of guidelines this year that I'm sure will come out on this. Now, the thing to look at this one is remote physiological monitoring treatment management services. A lot of words there. These can be the same day as chronic care management. So our chronic care management and complex management can be reported on the same day. So if you have a provider who is managing a patient's series of chronic conditions, and they are using these devices to monitor the patient and review the reports, they can do this, but they do have to document their time separately. So even though the review of this physiological monitoring is part of managing their chronic care, that time has to be documented differently, and if it doesn't meet the time limits, then you don't want to code both, you want to code one or the other. On these, they have 2 different codes, one of them which is a revised and resequenced, I believe. Let's take a look here. Where did the code go? Okay, so we have a revised and resequenced 99457. And this one states remote physiological monitoring treatment management services, clinical staff physician or other qualified healthcare professional time in a calendar month, requiring interactive communication with the patient or caregiver during the month for the first 20 minutes. And as I mentioned that there are a couple of insiders on this, there is a CPT changes, Insiders View 2019 and 2020 that talks about this, as well as CPT Assistant for January 19:3. So there are some different clinics out available on these codes. Our first one here, the first 20 minutes. Okay, and our second one for 99458, which is a new code and resequenced. Okay, so our first one was resequenced and revised. I'm sorry, I called that one new. This one is our add-on code 99458. And so unlike our other ones, you'll want to add this for each additional 20 minutes after the first. Okay, so we're going to make sure to pay attention to those add-ons, pay attention to how the time is documenting, because as we see here, it's one or the other, but when we get to our remote physiological monitoring, it's one plus the other, depending on what is documented. Now, the cool thing about these is that you can count them with chronic care, but you cannot count them with other E&M services. So if the patient's getting seen for something else within the office, and I believe, again, we're looking at within, let's see, so this one is actually a little different. So this is, do not count any time on a day when a physician or other qualified healthcare professional reports a service. So because these ones are calendar visits for those 20 minutes spent in each additional 20 minutes, that's within an entire calendar period. And so to really understand how that works, I wanted to talk to you about our care management services, because this kind of falls under that type of issue that we've seen popping up recently. So the idea within our documentation with our calendar reporting, you do have to have some sort of documentation that is able to be added to in your electronic health records. So if a provider is reporting any of these care management services or remote physiological monitoring, where it's billed based off of time in a calendar period, you want to make sure that you can track each time the patient is being monitored or reviewed by the provider. You want to, as I mentioned before, you cannot count time on the same day that they're seen by the provider or somebody in their healthcare clinic. So you want to make sure that you have some way of tracking that. You want to basically, when you're reviewing the note, be able to see specific time and add it up for the entire amount in the calendar. Some of these other services that I wanted to go over, which kind of follow this same concept, starts with our care management services, which falls under my current AMA edition professional CPT 2020 in the E&M section on page 50. And I know that was backwards in the video, forgive me for that. So care management services, this is just kind of a brief breakdown of what they are specifically. This is the time the provider or other staff in the office is taking throughout the month in order to maintain and monitor certain patients who may need more attention than what is given to them during the office visit alone. We have both chronic care and complex chronic care that starts this off, which is basically, again, looking kind of the same as our physiological monitoring. We base it off of time in 20-minute increments. They do actually break this down. So chronic care management, code 99490, is for chronic care management at least 20 minutes of clinical staff time directed by the physician or other qualified healthcare professional per calendar month with the following required elements. There's multiple conditions, meaning 2 or more chronic conditions, expected to last at least 12 months or more, or until the patient has deceased. Chronic care conditions place the patient in significant risk of death, acute exacerbation, decompensation, or functional decline. So this is not for ongoing chronic care conditions that don't need to be monitored. This is something that we're watching to ensure that they don't become worse or to assist when they do. Also, a comprehensive care plan established, implemented, revised, or monitored. And so there does have to be documentation of all this. There are some very specific in-section guidelines on these, which should be read when using these codes. Now, the first one here, 99490, is for your first 20 or at least 20 minutes, which means to me that any amount of time up to 20 minutes would be used for this code. You do have 99491, which is going to be, let me just write that out so it doesn't look like a monitor or a modifier there. And this is for your time for at least 30 minutes of physician time. So this one's a little bit different. Chronic care management services provided personally by the physician or other qualified health care. And so you'll notice the difference between clinical staff time of at least 20 minutes versus personal time by the physician, 30 minutes of at least 30 minutes. And so you want to have 30 minutes or more for this second code, whereas the first code is at least 20 minutes. And I said up to, and I'm sorry, let me retract that. The second one is complex chronic care, and so it has a couple of additional guidelines here. So the difference between it's ongoing, it's doing okay, but we're watching it, versus it becomes complicated. And you have two codes here. Both of them organized the similar way, 99487 and 99488. I'm sorry, 89. You'll notice that 99489, however, is a add-on code as opposed to physician versus clinical staff. And so both of these, neither of them indicate here that it is going to be specific to the physician. It just says chronic care management services with following requirements. So I would say that for these, this would be physician time. Although it does say on the secondary, it includes clinical staff time directed by the physician. So that would be something to look at, pay attention to. There are a couple of insiders on that one as well. The CPT changes, Insider View 2013 and 2015 goes over it. There's also several CPT assistants that cover this. The next series is our Psychiatric Collaborative Care Management Services. Now, these are services for ongoing care with patients. There's a couple of different definitions listed, so you should read through those guidelines here. The psychiatric services, you have initial for the first calendar month up to 70 minutes. And so this one is also a calendar month, and it's including things like outreach to the patient, assessment of the patient, various different details. The patient here is in consultation with a psychiatric consultant directed and treated by a physician. And so the difference is who you're billing for. If you're billing for a psychiatrist, obviously you would be billing with some of their codes. But this one is for management services. If you're collaborating with another provider and your provider is not a psychiatrist, you want to be able to bill for their time. There's billing for subsequent psychiatric care, as well as initial collaborative management add-on code for each additional 30 minutes. And so these ones are 99492. That's part of that. 99492, 493, and the add-on code 99494. Okay, the next one is transitional care management. This is services where a patient is being transitioned, typically inpatient, although sometimes they can be like in a rehab hospital. They give a couple of definitions here: long-term acute facilities, observation status in a hospital, skilled nursing. So there's several different inpatient settings that they can be transitioning from. This is intended for patients who are having difficult times with the transition. And so they give some examples for non-face-to-face services that can be provided by clinical staff under the direction of the physician, including communication with the patient regarding aspects of their care, and this can be patient or family members, communication with home health agencies, patient or family caretaker education services, assessment and support of treatment regimens, identification of community and health resources, and facilitating access to care. There's also non-face-to-face services that would be provided by the physician. Those include obtaining and reviewing the discharge information, as well as reviewing the need for the follow-up, interaction with other care professionals, education of patient and family or caregiver, establishment or reestablishment of referrals, and assistance in scheduling for follow-ups. And so the time for transitional care management can come from both the physician or the staff under the physician's care. It does need to be documented as to moderate versus high complexity, depending on how detailed that is. And you can bill based off of the face-to-face visit within 7 days or within 8 to 14 days for that transitional care management. And those are 99495 and 99496. And after you pass through the in-section guidelines, you can see the details on these. These are telemedicine, and so you're going to be billing the time that's spent based off of the communication within 2 business days of discharge and a face-to-face visit within the amount of time from the discharge. So this is all the time in between that transition before they have a face-to-face visit. Okay, our last two are our advanced care planning, and I didn't write it up here, but also general behavioral health integration care management. The advanced care planning is the first one I wanted to list. There's 2 of these, 99497 and 99498, which is an add-on. I know I didn't list the add-ons up here. I believe it was this one. The 99497 and 498 for advanced care planning. This is the time the physician spends with the patient and or family in discussing information about advanced care planning, and they actually give a full description of what that entails. But it doesn't necessarily mean the patient has to make any decisions during that visit. This is specifically just for counseling time. If it's done on the same day as an E&M, you guessed it, this time has to be documented separate of any other billable services. The first thing that comes to my mind is the time spent on this should not be reported with the Medicare annual wellness visit unless it specifies it specifically, because I know they have some really strict guidelines on those. And this is typically included. So this would be a patient that is coming in, might be seen for other issues, but at this time, no active management of problems is undertaken during the time period reported. And so what that tells me is maybe they came in because they were concerned about, just kind of what's going on with where they're at. And instead of treating actively those conditions, the provider says, you have a lot of plans and a lot of thoughts. Have you thought about this? And so your advanced care planning is based off of the time spent, documented specifically on these services. And our first one is the first 30 minutes, while we report each additional 30 minutes with that add-on. And so this is 30 and each additional. Okay. Our general behavioral health integration care management. Okay. I'm just going to abbreviate that here. There's one code that's been resequenced here for care management services with behavioral health conditions, at least 20 minutes of clinical staff time directed by the physician. Okay, and this includes various follow-up with the patient, assessments and monitoring, behavioral health planning, facilitating and coordinating care treatment, and continuity of care. Okay, so this one is also going to be based off of a monthly time. And you'll notice that most of these are calendar monthly times. Some of them are based off of the time spent that day. The important thing when you're reporting care management services, keep in mind that each one of these has its own specific in-section guidelines, but with a lot of the care patients are receiving these days, most of the services should be done or can be done remotely from the patient without the need for them to continue coming in. Because of this, we're finding ways to identify our providers' time and give them credit for the services they're doing, and also encourage a lot of that time. That's all I have for this video. Make sure you watch our other videos on E&M coding, and let me know, as always, if you have any questions by emailing me at mgrant13@cnm.edu.